Recording. Good morning. Hello, everyone.
Hello.
Hello, how are you doing? Good to see you all. Yep. Lynette, I can see you over there. Yeah.
Shall we start?
Yes.
I think we've got quorum, and
Yes.
we've got Mrs. Beatrice Mutale with us. So I think we're going to start the program and for the day. Thank you everyone so much for joining us for this very critical meeting, which is a regional multi-stakeholder consultation on co-creation of resilient sex worker programs in emergency and humanitarian settings in East and Southern Africa. As we know, COVID-19 has really thrown a spanner in the works in terms of how we usually worked and how we usually functioned in a lot of our spaces. But we do know that there have been numerous disruptions in terms of programming, in terms of areas of livelihood, in terms of how we access services in the last 18 months. We are resilient people, we are a resilient community, and we know that at current point, sex workers, even during the COVID-19, were one of the key populations that actually came together and assisted everyone, whether or not it was providing food parcels or ensuring that other communities or vulnerable communities received healthcare services. These were our colleagues who were in the front line helping in this process. At current point, we're sitting in a lot of countries which still criminalize sex work, but we're also sitting with a big problem that livelihoods have been distorted by the COVID-19 pandemic. This is why we've got this convening. We have arranged this convening for us to come together and to try and find solutions that are going to be sustainable. And for us to actually try to frame these in a palatable manner so that for the next 5 years, we are able to focus on the same goal. The meeting has been developed or is actually as a result of a collaboration between UNFPA and the African Sex Workers Alliance. And the meeting was also, in terms of preparation, was also a product of many other partners, including the UN family. And some of these are the World Food Programme, UNDP, UNAIDS, UN Women, the International Organization of Migration, ILO, as well as UNHRC. We then came together with NGOs, as well as civil society partners, such as the AIDS and Rights Alliance of Southern Africa, Frontline Alliance, as well as the Global Network of Sex Work Projects, NSWP. So as we've come together as one family to try and find solutions, especially around 3 critical areas. These include livelihoods, human rights, as well as access to services. Without further ado, I would like to hand over to Madam Beatrice Mutale, who is the Deputy Regional Director of UNFPA, to give us welcoming remarks. Thank you very much.
Thank you very much, Lynette, for that. For your remarks as well, and really opening the meeting for us. Colleagues, I'd like to just start by saying a few remarks and really wishing all of you a very good morning, welcoming you to this meeting. I have no doubt that we are all ready to engage to find solutions to the challenges faced by sex workers in our region, especially in the context of emergencies and humanitarian settings. Lynette gave us, a really great background of the overarching challenges that sex workers have gone through. But before I go further, I'd like to also just acknowledge the multiple partners that have collaborated with UNFPA, and I know Lynette mentioned some of them. These include the African Sex Workers Alliance, ASWA, the UN family, which again Lynette alluded to, including ILO, IOM, UNAIDS, UNDP, UN Women, and WFP. Also really acknowledge the collaboration that we've had with ARASA, the AIDS and Rights Alliance of South Africa, We also want to appreciate the participation of both the Global Fund and PEPFAR in this meeting. Both organizations, we all know, have been key in supporting the HIV response in this region. And the presence of multiple sex worker organizations and the number of frontline organizations supporting sex work programs is really pleasing. I also recognize participation of government officials and private sector. And last but not least, I really would like to thank the government of Sweden for their support in this meeting through the Together for SRH program. This clearly, looking at the participation, this clearly is a multi-stakeholder meeting, and the collaboration really demonstrates the importance and criticality of this subject matter. Simply put, sex workers' lives matter. From the UN side, our joint approach is a testimony to our commitment to our One UN, working together as one. Now, taking us back, the experience of COVID-19 and Ebola have been a painful reminder about the vulnerabilities of all of us to pandemics and epidemics. In addition, humanitarian challenges such as wars, conflicts, and natural disasters, which are common in the region, have tended to expose fault lines of inequality in our communities. We clearly live in a world of inequality, and those most marginalized suffer most when pandemics and humanitarian challenges strike. 2020, at the height of the hard lockdown from COVID-19 in this region, we had countless stories of the suffering of sex workers from the media. Being aware that sex workers have historically suffered from all forms of discrimination, stigma, and discrimination, interest to undertake a rapid assessment on their welfare developed. We sought to examine the impact of COVID-19 on sex workers programs with a special focus on their livelihoods, human rights, and access to health services. The study results will be shared in detail this morning, but it suffices to say that the study confirmed our fears. For instance, we confirmed that livelihoods were seriously disrupted. About 80% of the respondents reported loss of income. This had, of course, a chain reaction resulting in food and housing insecurity. In countries where social protection measures were available, sex workers were excluded for various reasons, including lack of legal recognition of sex work,
We seem to have lost Ms. Mutale. She's having internet problems. I think she will be joining us again to finalize her speech or her opening remarks. What I was hoping we would do in the meantime, as we wait for her, is just to perhaps open it up to, Mr. Innocent. If Mudisatzile, if you could please just continue and perhaps assist us by finalizing those opening remarks. Mr. Mudisatzile, would you be able to do that for us? Apologies for putting you on the spot.
Sorry for the inconvenience. Things are being worked out, and let's hope for a way out. Lynette?
Thank you very much, Charles. I was hoping that we could add Mr. Mudisa Tile so that we can at least conclude that. If we could just conclude, UNFPA's opening remarks. So he's been currently added as a speaker, and then he will just conclude. Thank you very much for your patience.
Good morning, colleagues. Sorry for the technological hiccup. I think, can you hear me?
Yes, we can hear you, Innocent.
Okay. Yes, I hope the Deputy Regional Director will be joining us. But if not, I think a key message really was just to remind us that COVID has had a major impact, a negative impact on the population of sex workers, and that in the three areas around livelihoods, around human rights, and also around access to health, were seriously challenged. And that hopefully we will all engage and try to find solutions in this meeting on how to avoid a similar situation happening in future. We know that for many years, sex workers have been one of the groups that has been negatively affected by all kinds of challenges. So her hope is that this meeting will afford us a platform to engage and find long-lasting solutions so that as we march to 2030, no human being is actually left behind, including sex workers. So really, I think really that's the key message, and appealing to all of us to engage and support each other to find a solution along those lines. Thank you. Over.
Thank you very much for that, sir. We truly appreciate it. I'm now going to hand over to Ms. Grace Gamal, who is the Regional Coordinator of the African Sex Workers Alliance, to please do her opening remarks. Charles, will it be Grace or yourself? Ms. Gamal?
Yeah, Grace is supposed to do it. Yes.
If you could please join us. Thank you.
All right. So before Grace joins us, I just want to remind you that this meeting is about strengthening sex workers' HIV programming in emergency and humanitarian settings in East and Southern Africa.
Okay. Grace seems to be struggling to unmute herself. So if the meeting, if our technical team could please assist by unmuting Grace, as well as just showing us her video, we'd really appreciate it. Tam, thank you.
Also, just to remind you, please register your names, the organization that you come from, and also the country that you come from. Just put that on the chat box. We'll be very glad.
I think I'm sorted. Hello?
We can hear you, Grace. Please continue. If you could just also just screen your video. Thank you. Thank you, Trace.
Okay. My sincere apologies because of technology. I couldn't figure out how to unmute myself.
That's fine.
Okay, so
Yeah.
sincere apologies. So good morning, everybody, and thank you for this opportunity. And I want to welcome everybody to this discussion. It is a great morning to have this discussion. And I also want to appreciate everybody, all the sex workers who found time to join this conversation this morning. And also, I want also to appreciate the UNFPA for the great work and the great support that we have worked together in this journey, and also making a reality that this meeting happens. The regional multi-stakeholders consultation to strengthen the sex worker program in emergencies and humanitarian settings in Eastern and Southern Africa. So many times and many years that we have done our programs, we have left out the sex workers in the emergency and humanitarian settings. So I'm excited that this conversation is happening. And we as the African Sex Workers Alliance, we also want to appreciate Global Fund and PEPFAR that has been part of this process. And knowing that 90% of the funding to key population comes from PEPFAR and Global Fund, and the fact that they have been part of this process, and also acknowledging that the rights of sex workers, and mostly the sex workers in the humanitarian and emergency settings, are very important. So thank you so much. And also the UN folks. Yes, we are very excited. So as the African Sex Workers Alliance, for the 10 years of activism and the movement building, we are very excited to see that in the Pan-African Alliance, we continue to build a very strong sex worker movement, and we continue to build a very good cohort of sex workers, and also a very good movement, and continue strengthening sex workers in the 34 African countries that we have presence. And so this is very exciting, and we continue to appreciate the sex workers who toiled so hard to ensure that movement building becomes a reality in Africa. So thank you so much to the sex workers and also the partners who have worked with us in this journey. And so I come to also in these times of COVID-19, we know there have been very many challenges that have come with COVID, and mostly to sex workers. This is not limited to increase in gender-based violence of sex workers, increase in infections among sex workers. We have also seen the socio-economic we have also seen the social and economic issues of sex workers being affected. We have seen that most of the sex workers have lost income during COVID. And so we want also to appreciate the sex workers who are who are able to even adapt in times of COVID, and also looking for viable activities to do during COVID. We saw sex workers who are providing clinical services going out of their way and talking to donors to get mobile clinics, which can be able to continue providing services even in times of COVID. And we appreciate donors who have been very flexible in this journey and ensuring that sex workers continue to thrive even in times of COVID. Also, we have also seen the resilience of sex work movement during the COVID times. Even with COVID, the sex worker movement continued to organize. We continue to do our activities in different countries. So this is a big, a huge success to us as sex workers, and this is something that we continue to do. But I think with COVID, one thing that we have learned is we need to think and strategize. In times of pandemics, how do we want to continue doing our programs? We need to now start strategizing, because we have learned from COVID what happens maybe in another 5 years if we get another pandemic. How do we ensure that resilience of sex work movement continue to be there? Because this one came up as an emergency. So how do we, the learning that we have got from COVID-19 experience as sex workers, how do we build our movement? And also, I also want to talk about the stigma and discrimination that continue to exist in the movements that we are in. And also, how do we continue as sex workers also advocating for the issues where trafficking is conflicted with sex workers? How do we continue advocating for this? And also, as sex workers advocate, even advocating for the universal health coverage, because we know even with COVID, if universal health coverage was something that was real, we could maybe have suffered more, because we saw government programs running, we saw government giving even like food supplement to people, but sex workers were not prioritized. We also saw the COVID-19 vaccination that continues to be done, where we have seen sex workers shying away from getting COVID-19 vaccination because of the myths. But if we had the universal health coverage, maybe things would be better. So how do we continue advocating for this? And finally, I also want to say that I think this is a conversation that we need to be doing more oftenly, because we have sex workers who are living in emergency and humanitarian settings, but we continue to see people conflicting sex work and trafficking in these settings. How do we continue having this conversation and ensuring that people don't conflict this? And with that, I wish all of us a successful day and a successful meeting. Thank you so much.
Thank you so much for that, Ms. Kamal. We truly appreciate it. And for also stating the challenges that are being faced by sex worker communities, but also how resilient we are as a people. I think what COVID has taught us over the last 18 months is that business is no longer as usual. So we really need to adapt to our new circumstances. And I think this is a brilliant opportunity for us to do that. My name is Ginelo Lenet Mabote, and I'm going to be your wonderful facilitator for the next 3 days. I'm going to be joined by Charles from the African Sex Workers Alliance in coordinating and in facilitating the various sessions. So do stay tuned for those. Before we start the meeting or officially get into the first panel discussion, I wanted to ask colleagues to please follow the following house rules. So we've got speakers. So we request that all of the speakers, please write your name in your name as it appears in the program, and then put an asterisk or a star sign just before your name, so that our tech guys can know that how to identify you as a speaker when you are speaking and on the day that you're speaking. Secondly, please do feel free to use the chat box to ask questions to the panelists as they're speaking, because we are going to have Q&A sessions, but sometimes we do know that we run over time. And to make up for that time, we want to make sure that you are being consistently engaged and are asking speakers questions. They will address these. Where we have time, and where we have Q&A, I will definitely make sure that some of those questions I ask the panelists. The last thing that I wanted to just mention is that For the breakaway session, as you will remember, when you registered for this meeting, you chose the breakaway group you wanted to belong to. That information has been shared with you via email. So please, when the time comes for breakaway sessions, do not stay on this link. Go back to your email and join another link, and that link will take you into the room where you'll be in a breakaway room to discuss the issue that you had registered for during your registration. And that is where you will be with the chair and a moderator in order for you to discuss the issues that are going to be presented to you. Without further ado, I now welcome Mr. Charles, who is also with the African Sex Workers Alliance, who I've worked really close to pull this meeting off together with. And he's going to be basically taking us through a panel discussion with some of our colleagues who are going to be speaking about their different perspectives, but having a same united voice. We'd like to hear from the sex workers themselves about how they've responded to challenges posed by the COVID-19 pandemic. Over to you, Charles, as well as your panel. Thank you.
Thank you so very much, Lynette. We are moving forward we are moving okay. And to save time, I would like to talk about this next session, different perspectives, same united voices, sex workers responding to challenges posed by COVID-19 pandemic. So without much ado, I would like to introduce to you Lungile Kumalo. She is a sex worker. She is the director of Voices of Our Voices in Eswatini. So Lungile, kindly, you're so much welcome to speak about your perspectives. You're welcome, Lungile. Lungile, over to you. Pleasure to welcome you. Please unmute. Unmute yourself, Lungile. Check your microphone. We still can't hear you.
Charles?
Yes, now we can hear you.
We can't hear her, but perhaps you can go to the next panelist, and then we'll come back to Ms. Lungile once we've sorted out her audio.
All right,
okay.
that's fine. That's fine. Okay, our next panelist, Lungile, sorry for that. Please bear with us. Life is sometimes full of those kind of challenges. The next speaker is Joyce Athiambo. Joyce is a member of faculty from Sex Workers Academy Africa, and she is out and she lives as a positive. She lives positively, and she's proud of that. So Joyce, you're much welcome, and take the stage. Joyce, over to you. Joyce, over to you. Joyce, try to unmute yourself. Joyce? Joyce, try to unmute yourself.
Charles, perhaps we move on to the next speaker and then we'll come back to Joyce as well.
Sorry for the inconvenience. Joyce, we will hold you for a minute. We go to the next speaker for as we sort the technical issue, please. Let's try the next speaker, Mr. Mark. Mr. Mark. Mark is from Queer Sex Workers Initiative Kenya, and he's going to talk to us about the migrant sex workers and the plight that they go through and the challenges that they face during this COVID-19. So, Mark, please take the floor. Mark. Mark, can you hear? Mark, can you hear us? Please, technical department, kindly assist us. The speakers are not able to speak.
Charles, perhaps we move on to Martin and then we'll go back, we'll circle back.
All that you touch is frozen. I went from hot to ice. You can't stop this door from closing. You chose your path of life. Don't have me. Do you need me? Don't have me. Don't have me. Do you need me? Don't have me. Yeah, yeah.
Good morning, everyone. I think that what we will do is, in the interest of time, while we're preparing for that panel, which is a very critical panel for us to have, we will move on to the next session. And this is the session that I think is also a foundation for why we've had this meeting. As you've seen in the program, or as you've seen in the flyer that we've sent to you, this meeting was basically as a result, or was informed by an assessment that was done, a rapid assessment of the impact of COVID-19 on sex worker programs in East and Southern Africa. We're going to now call, respectfully, apologies to put you on the spot, the next speaker, if we can ask to be added, who is Maria Stacey, and Maria is the director of Equal International Africa, and she worked on the report. So Maria, you can share your screen. Please do share your screen as well as your presentation, please, so that you can just inform us about what the study was about, and the results that you found from the study. Thank you very much.
Hi, everybody. Good morning. It's really nice to be here and really nice to see so many familiar faces of people that I've worked with over the years all over East and Southern Africa, and so many amazing sex worker activists. Let me just start my slideshow. I hope everybody can see that. So I've got 15 minutes to give a presentation, and the study report was rather long, so that's quite a challenge to cram it all into 15 minutes, but I hope that I can get across the most important points just to stimulate discussion today. I want to thank a few people before I start. I want to really thank Innocent Modisautsile from UNFPA for really driving this process. I think it was his idea, and he approached me towards just after COVID started, actually, around doing this report, doing this research project. And, you know, as a researcher, sometimes you do work as a consultant, sometimes you do work and it kind of, you fear it's just going to get dusty and sit on the shelf. So I really want to thank Innocent after the report was submitted for driving this process and bringing a really fantastic partnership together, consisting of ASWA and the UN partners and other partners, to elevate this issue and to get more and more people talking about it. Yeah, just also to say that this research took place between August and November 2020. So just bear that in mind. You know, this was, people were talking, they were just coming out of lockdowns, or they were still in lockdowns when this research was taking place. I just want to also thank Grace for your opening remarks. You've touched on a lot of issues which come up in this research, and also for Dr. Beatrice from UNFPA, and especially for the point that she made around sex workers' lives mattering. Sex workers' lives matter. And I just want us all to pay attention to the names on this list. In the course of the few months of the research, these were people who were mentioned to us. And sorry, just to say that I did this research with Dortia Gutu of ACPEG. And yeah, we conducted this research together. In the course of the interviews and the surveys that we did, people told us stories of sex workers who had died. And these are the names of those that we could get names for. We did check with their organizations whether it was okay to publish their names. And we got the permission of their organizations. Just to say that these people didn't necessarily die of COVID, but of some of the conditions relating to lockdown and the interruptions in services which happened, and indeed the human rights violations which happened as a result of COVID. So it's always important to remember that sex workers are human beings, are somebody's family member, or somebody's friends, are mothers, fathers, daughters, sons, brothers and sisters. So we honor the names of the people, those we know, who died during COVID. So let me quickly talk about what the purpose and objectives of the study were. Sorry, I'm just going to take myself off. I'm going to stop my video while I'm presenting and just hide that gallery view so I can see the text. So the purpose of the study was to document the impact of COVID-19 on sex workers programs in East and Southern Africa, with a particular focus on their livelihoods, human rights, and health. And the objectives were to assess the impact of COVID on sex workers programs, to assess the extent to which organizations led by or providing HIV and SRH services to sex workers have been able to continue to do so, to identify the strategies which they used, sex worker organizations, used by sex worker support organizations to sustain livelihoods, ensure continuity of services, and uphold human rights in the context of COVID containment measures, to explore the opportunities to use the skills of sex workers and their organizations gained in the HIV response to address COVID-19 and other public health challenges, to document examples of good practices, to identify lessons learned, and to provide recommendations to guide sex worker programming in humanitarian settings or in other settings where adversities arise to ensure resilience. As Grace said previously, in many humanitarian crises, sex workers have been excluded from relief efforts. And COVID has really given us a chance to examine this exclusion and to say that this should not happen in the future. Next slide. All right, just to very briefly go over the methodology. So we did a desk review. At that stage, there weren't too many journal articles. So a lot of the articles that we were using were articles from the media. We did 18 interviews with 21 participants. These were either individual or round table. They were all virtual. And everybody was from East and Southern Africa, except for one who was from UNFPA Asia Pacific. As UNFPA Asia Pacific had already done some really great work partnering with the Asia Pacific network of sex workers. We spoke to a range of sex worker organizations, sex worker-led organizations, service providers, development partners, and advocacy organizations. We really wanted to speak to those who were working at the coalface, who were interacting with sex workers on the ground, working at grassroots level. We wanted to hear the stories from them. And we also were very mindful that the people we spoke to we needed to capture the intersectionality of sex work. So sex workers are a very, very diverse group and include LGBT sex workers, migrant sex workers, drug-using sex workers, and these so-called subpopulations are often further marginalized, or let's say doubly marginalized or doubly discriminated against. We also did an online survey, and we got 69 respondents from a wide variety of countries: Kenya, South Africa, Zimbabwe, Malawi, Uganda, Tanzania, Burundi, Eswatini, Lesotho, Eritrea, Seychelles, and Botswana. And I'm happy to see in the chat that a lot of people from these countries, including countries like Eritrea that we don't often see in conversations like this, and Burundi, are participating in this call today. And there was a wide variety of people, levels of seniority. There were board members, executive directors, all the way down to peer educators and members of sex worker networks. We then did data analysis, qualitative content analysis to identify the common and the alternative themes. Our study did have some limitations. We were only able to conduct the interviews in either English or Kiswahili. The survey was in English. So we had an underrepresentation from the Portuguese speaking and the French speaking countries. We did have some, but especially the Indian Ocean Islands. I think we only had 1 or 2 responses. And then we did try to speak to government, but we were not able to obtain any interviews with government stakeholders, which is a pity. So very rapidly, this is probably something that most of you know, but the status of sex workers in East and Southern Africa pre-COVID just to remind ourselves, sex work is criminalized in every country except for Mozambique. Sex workers experience pervasive and persistent physical, sexual, psychological, and structural violence. Sex workers are a key population for HIV due to many drivers, behavioral, social, structural, and human rights barriers. They have high rates of HIV in many countries in the region, from 55% in Malawi, 57.7% in South Africa, and all the way up to 71.9% in Lesotho, so extremely high levels of HIV, normally more than any other key population in most countries. And they experience widespread stigma and discrimination, including from healthcare providers. And previous research has found it's not just related to HIV, it's actually any kind of health issue, but especially those that have to do with sexual and reproductive health, where sex workers experience barriers. COVID really highlighted the fact that the disease, the pandemic, really highlighted inequality and exacerbated inequality. And this kind of marginalization and vulnerability, it's intersectional. So as I've mentioned earlier, it's worse for people. It tends to be worse for people who have multiple identities. So sex workers who are gay or migrant, who are living with HIV or TB, or who are homeless, or whose work is very informal. So we need to have an inclusion lens and an intersectional lens when we prepare and respond to humanitarian crises. All right, so what I'll do is I'm breaking the findings down into livelihoods, human rights, and health. And when we administered the survey, this shows the results of the survey. We asked in the survey, how has COVID affected sex workers' livelihoods? And people could choose, it was an open-ended question. So people just wrote down sometimes a variety of responses. And then we went through the responses and looked at the themes, and then we categorized the themes. So that's how we got to this graph. So, the majority of people said sex workers had a loss of income. They experienced hunger. They were evicted from their homes. Some mentioned that they were excluded from social protection, and also that they were displaced, had to migrate out of the cities to rural areas or to other places. Excuse me. Next slide. So what people told us is the majority of sex workers are informal workers, and they earn a daily wage. So that's very precarious. They are very vulnerable to economic shocks, to the upturns and the downturns in the economy. And what happened was that in many countries, there were lockdowns and curfews. And for those who worked in bars or in brothels, these were closed down. There were restrictions on travel, so people couldn't travel to go to work. Because your clients couldn't travel, there was a decrease in the number of clients. And those clients that did come out, or that did find sex workers, often forced them to lower their rates, to accept lower rates, or because the clients were also struggling financially, sometimes they would offer goods like food or something else, favors instead of money. And this also forced sex workers to agree to riskier practices. As I just mentioned, some went out of the urban areas and went back to their family villages, which came with a whole set of challenges. And foreign migrant sex workers in particular were stuck often unable to cross borders to go home, but also unable to access any social protections in the country which they've migrated to. And then some people did mention that there are now new entrants into the sex work industry, as many people have lost their job and were economically desperate. So there was food insecurity. Hunger was mentioned a lot. With brothels being closed, a lot of sex workers stay at the brothels where they work, and they had to move out. We heard stories in Uganda of when brothels were closed, sex workers being kicked out on the streets. In some places, there were forced quarantine. In South Africa, there were some quarantine facilities for homeless people, and a lot of homeless sex workers were sent there, but were denied health services. And eventually that quarantine facility was shut down by the South African Human Rights Commission. They were often excluded from relief measures for a variety of reasons. The one is maybe they didn't know about it because they're marginalized, but sometimes they were actually actively told, no, you're a sex worker, you can't access this aid. The other thing is a lot of sex workers, because of their often precarious lifestyles, they lack identity documents or proof of address. In South Africa, we have unemployment insurance, but even if a sex worker is formally employed by a brothel, for example, because sex work is criminalized, they would not be able to access this. Many humanitarian programs which do vulnerability assessments do not recognize sex work per se as an indicator of vulnerability. And we really got some amazing quotes during this research, which you've probably read here while I've been talking. So the one example is of a woman being attacked, a sex worker being attacked by an angry mob while waiting in line for food distribution. They broke her arm, they beat her, and she still did not get the food that she was waiting for. I'm just finding lost my cursor for a second. Let me see if I can, there we go. Okay, so the findings around human rights. We asked again, how has COVID affected sex workers' human rights? And people said the first thing that they mentioned was violence from police, which definitely increased. And this included assaults, rape, extortion, bribes, stigma and discrimination. Sex workers were scapegoated. There was an increase in arrests. There was an increase in domestic or intimate partner violence. And then there was physical, sexual, or economic violence from clients. So I'm just making a note of some of the human rights that were violated, with the most important one being the right to life. And as I mentioned right at the beginning, we noted 16 sex worker deaths, and most were not due to COVID itself, but due to the containment measures. So one sex worker, Robin Monsuni in South Africa, died in police custody. One sex worker was murdered by a client. 2 were murdered by their intimate partners. Excuse me. 4 from health conditions exacerbated by homelessness, such as diarrhea disease, tuberculosis, etc. And 5 due to interruptions in their HIV treatment. So as I've mentioned, there was definitely an increase in violence from police and the military, assault, torture, rape, harassment, extortion, and requests for bribes. So ASWA related and they shared the results of the survey which they did with their members. And they asked their members, how often have you heard about cases of violence against sex workers during the pandemic? And 63% of the members who responded said every day they hear about violence against sex workers. And 22 said a few times a week. So if you put that together, it's 85 saying more than a few times, either a few times a week or more. And in Lesotho, peer educators were even beaten by police while trying to deliver services. There was also an increase in discrimination. And just as with HIV, sex workers were scapegoated as the vectors of HIV, similarly, they were scapegoated often as vectors of COVID in the media, by community leaders and by political leaders. Then gender-based violence, we heard a lot that GBV was the second pandemic, and there was a lot of concern expressed about gender-based violence, especially intimate partner violence. And research has shown that sex workers are always at increased risk of violence compared to the general population. So this one story, a sex worker in Webuye moved in with her boyfriend who did not know that she was a sex worker. When he found out, he beat her. She bled to death as she was being rushed to hospital. This is what somebody from Keswa told us. In terms of healthcare, how has COVID affected sex workers' health? The most common answer was that the HIV treatment was compromised. And then the next common answer was that sex workers had challenges accessing healthcare facilities. Often community-based services were closed, or services were reoriented to just deal with COVID. HIV prevention was also compromised. SRH services were also compromised. Stigma and discrimination was experienced in healthcare. There was an increase in unprotected sex, and then mental health was also mentioned by quite a few, but I think that COVID has really highlighted for us, has really shone a spotlight on the issue of depression and stress and mental health. It has been, maybe we can call it the third pandemic. But there were a minority of people that said that because sex workers are often already engaged in key population-friendly services and have relationships with peer educators, that perhaps treatment for them was not as compromised as it is for the general population. I'm going to speed up now because I'm mindful that I'm kind of starting to run out of time.
It's okay, Maria. Take your time.
Is it all right?
I'll give you some time because this is a very important presentation on the study. So please.
Okay. Okay. So some of the barriers and challenges which I'm slowing down my speaking now. Some of the barriers which respondents spoke about were the fact that healthcare facilities were short-staffed, or that staff lacked PPE, non-essential services were closed, especially like drop-in centers, community-based drop-in centers were closed. But then sometimes people were unable to afford user fees in countries where user fees are charged, or they didn't have masks or PPE, so they were not allowed to go into facilities, or they lacked documentation, or they were non-citizens. So one very striking story was told by a peer educator who works for MSF in Malawi, and she said they are not able to access medical health services because to enter the gate of the hospital they need ID that many sex workers don't have. For instance, what happened here in our workplace, a sex worker was pregnant and the time to deliver came. When she went to the hospital gate, they chased her away that she must enter with an ID or she's not a Malawian. She went back and met us at our office where suddenly the time to deliver came and she delivered the baby in our office. And then Sisonke said to us that when they went to clinics, there have been remarks, don't bring your corona here when sex workers have gone to clinic. HIV prevention services were also interrupted, and because of condom shortages or because condom distribution wasn't happening, there was an increase in unprotected sex. And as a result, there was an increase in requests for post-exposure prophylaxis. It's also very important to remember the kind of relationship which community-based HIV services have with sex workers, especially the peer educators. They don't just distribute condoms, refer for testing, refer for treatment. It's not just clinical, it's very, very holistic. And anybody who's seen a peer educator in action or a community-based sex worker-led organization in action knows that there's a relationship that develops with the whole person. So that peer educator knows where that person comes from, they know their history, they know if their boyfriend is beating them or not, they know about their children, how their children are doing at school, they know, if they've been targeted by the police, they know everything about them and they provide holistic support. That's a really, really important point that we have to remember. So how did COVID impact on the functioning of sex worker organizations? Well, like many organizations, they had to very rapidly adapt. They had to, now they don't have face-to-face contact with their community. So they did rapid surveys, they had to adapt their programs, they had to reprioritize, they had to procure PPE, they had to apply for emergency grants. They had to speak to donors around reprogramming existing grants. Staff had to now work from home. We're all used to it now, but it was a big shock and a big adjustment in the beginning. And not everybody had a laptop, had access to devices. It was a big challenge with data, computer literacy issues. And I mean, we're still seeing in this meeting how challenging it is to get 115 people together online and to organize a meeting. So, and this is 18 months into the pandemic. So it's just, really, really not the same as all meeting in a big physical space together. There were rapid response grants from a lot of donors. A lot of donors were really flexible, relaxing their grant criteria and their reporting requirements. But often the CBOs, which were on the coalface, weren't really eligible for some of the grants which the larger donors were giving. And so there was actually a lot of creativity and innovation from sex worker organizations. They started doing crowdfunding. They started just reaching out and helping each other. And I remember Dorothy saying during the research that people just said, I've got a spare room, come and stay in my spare room, or come and sleep on my couch, or, come and have a meal at my house. And people just open their doors to each other. So how did sex worker organizations respond to COVID? A lot of them developed IEC materials. They started WhatsApp groups, social media to share information. They distributed masks and sanitizers to members of the community. They created hotlines for psychosocial support. They assisted sex workers to apply for emergency grants. For example, here in South Africa, we had an emergency COVID grant, a social grant for the duration of COVID. It's actually still going on. And I know that Sisonke helped sex workers to apply for that grant, helping them getting their IDs and so on and filling in the forms. They partnered with humanitarian relief organizations. They distributed food and hygiene hampers. They went and spoke to landlords to prevent evictions. They found emergency accommodation and shelters. So here's an example from SWET South Africa. We launched a humanitarian relief appeal that was very successful. We initially put a target of 20,000 Rand, which is about $1,200 US. But we ended up raising over 250,000 Rand, which is $15,000, more than $15,000, which along with reallocations of donor funds allowed us to provide large-scale relief to hundreds of sex workers across the country, 704 adults and 939 sex workers' children. And then there was also monitoring of human rights violations, working with the media and rapid response teams. There was also a lot of, I'm sure we're going to hear about it, especially probably from the PEPFAR presenters, which is, I think it's happening tomorrow. There was a lot of adaptation of service delivery models to either 3-month multi-month dispensing or 6-month multi-month dispensing, micro planning, home deliveries of medication and commodities, linking displaced sex workers with health facilities. So for example, if a sex worker had migrated to the rural areas and didn't know where the nearest clinic was, or that clinic didn't have her history, there was a lot of organizations would introduce or ensure that that sex worker was able to link with the health facility in the rural area. There was switching to virtual case management. There was telemedicine. There was organizations which just put condom dispensers in public places so that they wouldn't have to hand them out, face to face. And there was an increase in self-management options like HIV self-testing. So just sharing some pictures with you of some of the initiatives from sex worker organizations during COVID. This is SWET using the money from the crowdfunding to buy grocery parcels and taking them out in the van to distribute them to sex workers and their families. There's Grace on the right and Felista on the left, and John Matenge in the middle, partnering with, so this is ASWA, KESWA, and Hoimas, partnering with the Kenya Red Cross to distribute care parcels to sex workers. This is, I saw that Modeste is on the call. This is from DRC. It's a little flyer which HODSAS and other sex worker organizations in DRC developed for sex workers to provide them with information. And you can see it's like really simple, but really clear. And this is from a community CBO supported by MSF in Malawi. The sex worker organization asked for a donation of sewing machines, and they started making masks to sell to the community while they were unable to work as sex workers. So what lessons did we learn? The impact of COVID containment measures on sex workers' livelihoods, human rights and health in ESA has been greater than the impact of COVID itself. So when they say that the cure is worse than the disease, that certainly has been the case. But what we have had and what mitigated the impact was that we have a foundation of ever expanding HIV programs for sex workers in East and Southern Africa. And we have this cohort of trained community workers and peer educators who had set up networks and who had systems in place. And that was the foundation on which the COVID response could be launched. Community-based and community-led organizations led the way completely. They responded swiftly because they're part of the community. They cannot, when their friends, their colleagues, their community members are saying that they are suffering, they cannot not respond. They've got their ear to the ground. They were innovative, they were agile, they used what little resources they had to try and solve problems. When there's social capital amongst sex workers, and by social capital, I mean when a group of people are connected to each other and support each other. So it improved the health outcomes. So in other words, when sex workers were connected to organizations and connected to each other in a sense of community, the outcomes were far better than those who were isolated, who didn't know anybody. Maybe they aren't out as a sex worker. They're living in a kind of an undercover clandestine way. So social capital definitely leads to better health outcomes. Criminalization and related stigma, discrimination and violence towards sex workers exacerbated the negative impact, and it increased the exclusion from services. Key population programs, but especially sex worker programs, are still terribly underfunded. So there's a study by AIDS funds recently that found that less than a fifth of funding needed for HIV programs for sex workers in 28 priority low and middle income countries was provided between 2016 and 2018, less than a fifth. So less than 20% of what is needed was provided. So this is the last slide. What were the outcomes of the study in terms of recommendations? Sex workers should be included going forward in social protection and humanitarian relief programs. Rights-based, evidence-based economic empowerment programs should be strengthened. And when I say rights-based, evidence-based economic empowerment programs, I don't mean exit programs. I don't mean programs helping sex workers to leave sex work. What I'm talking about is those which are tailored to meeting sex workers' needs. Whether they want to leave the industry, whether they want to stay in the industry but earn more money, or whether they want to gradually transition out of the industry and have something else to fall back on. Whatever sex workers choose is the kind of economic empowerment programs which should be promoted. Efforts to decriminalize sex work in East and Southern Africa should be intensified. So should action to reduce stigma and discrimination. Violence against sex workers must be addressed through community empowerment, through documenting human rights violations, fostering police accountability, strategic litigation, legal support, rights literacy training, appealing to national human rights instruments, and leveraging global commitments. There's a whole body of evidence now on what works to address violence against sex workers, and this needs to be implemented and scaled up. We should continue to decentralize and demedicalize health services. In other words, if it doesn't need to be done by a doctor or a nurse, if it can be done by the beneficiary themselves, the patient themselves, or by a peer educator, we need to intensify those efforts, because that brings the services more and more to the people. We need to scale up internet-based service provision, but when doing so, we have to remember that not everybody has access to the internet. There is a digital divide, and COVID has highlighted the digital divide. And we need to support sex worker organizations to be able to use, to harness internet-based service provision. And we need to strengthen support and funding for community-based and community-led service delivery. Remembering June of this year, the high-level meeting and the political declaration targets around dramatically increasing community-led service delivery. And that is my presentation. I thank you very much on behalf of myself and Dorothy. Thank you very much.
Thank you very much for that powerful presentation, and for actually underscoring the major issues that have faced our colleagues in the last, not even 18 months, in the first 12 months actually of the pandemic. I wonder how bad or how well it's actually gotten, in 2021. We're going to have to do two things. I do apologize. We do have questions for you and Dottie Maria, so please do stay online. But before we go to Dottie and Maria for the Q&A, a quick Q&A question and answer session, we'd like to go back to Dr. Beatrice Mutale, who's now with us, so that she can just bless our meeting and then go into another management meeting, I've just been told. So please do stay on, Dottie, please do stay on, Maria, and we will come back to a quick Q&A session. Let's just give Madame Mutale a few minutes to conclude her remarks. Thank you. We'll hand over to Madame Mutale. Do we have Madame Mutale? I think while we're waiting for her, I just wanted to just underscore some of the really critical points that you raised, Maria, in the research that the panelists will be speaking to around the various areas. And one very important point that you have raised is the social capital, the innovation, as well as the creativity that's come out of all of this. Because I think when you're a community and you stand alone and you stand marginalized, what you do yourself as a community is what stands true in terms of the test of time, in terms of building solutions. This meeting is exactly about that, and working with the UN family about how we co-create resilient mechanisms for sex worker programming in such settings. I do not think personally, I do not think COVID is going anywhere. I think it's going to be a chronic disease. So we're going to be facing another chronic disease over and above HIV, the TBs, and the other non-communicable diseases. It will be interesting to hear from colleagues how that is going to translate into something that is palatable, especially as you've mentioned, towards the 2025 goal that we've set ourselves at the recent HIV UN high-level meeting. Those targets are critical, and it is important for us to have a framing or framework that advances that. I hope now that we have given some time, we do have Madame Mutale to just give us her closing remarks. If not, I will just ask Dottie and Maria some questions, and then after that, we'll hand over to Madame Mutale to give us her concluding remarks, and then we'll move on to our panel of speakers, which was where we started. I've got questions for both you and Maria and Dottie, so I'll start with that. The first question is, under the right to life, could you clarify what you mean by 5 due to interruptions in HIV? That is the first question. The second question is from Meharina, and it is, what are the types of informant in Eritrea if exist? So I think it's what types of informant interviews were done in Eritrea, if that was the case. We've got another question from Raoul for Dottie and Maria, and that is, there were no more activities at the hotspot. What had you put in place in terms of service delivery at the hotspot and community level as COVID-19 regulations were concerned? So I think that is a question of what did you find in your research under that? And then we've got a last one around the recommendation. It says, under recommendations, rights-based, evidence-based, economic empowerment, you emphasize of their choice. What was your experience in the field? To what extent are economic reasons a factor for sex workers? What alternatives do they have? Dottie and Maria, over to you.
Hi, maybe Dottie can turn on her video.
Yeah. Hi.
Hi. So I can talk about the right to life. I can talk about the Eritrea question and the fact that there was no more activities at the hotspots. Maybe Dottie can talk about the economic empowerment and what the it sounds like the question is around what are the economic economic drivers of people entering sex work, and I think would they choose to do something else if they had the choice? I think that was the question. Maybe Lynette can reply. But let me go to the first three. So there was a question that we mentioned that 5 people lost their lives due to interruptions in treatment. Whenever we heard that somebody had died, we tried to follow the story back to the origin and find out where that story came from. And in some cases, we found out that 2 people were speaking about the same person. So we tried to do a little bit of detective work and get to the bottom of all of the stories. From what we heard, these were 5 people who were HIV positive and who had previously been on treatment. But during the pandemic, for whatever reason, there were a variety of reasons. Some people were too scared to go to the clinic and just stayed at home. Some people were scared of moving around because there were roadblocks, and people were often treated quite harshly at roadblocks and interrogated and asked for their documents and only allowed to pass if they had, for example, an appointment card or a card from the clinic. In some cases, local clinics stopped providing ARVs temporarily while they're geared up to deal with the COVID vaccine, the anticipated onslaught of COVID cases. So there were a variety of reasons why people stopped using their treatment and got sick. In terms of Eritrea, we didn't actually do any focus groups or interviews with people in Eritrea, but we had a response in the online survey, and it may have been somebody from UNFPA. I don't think it was a sex worker-led organization. The ASWA people, or Dottie, might know if there are any sex worker-led organizations in Eritrea. It will be quite interesting. And then the question around there being no more activities at the hotspots. I'm not too sure whether the person means that there was sex worker organizations were no longer able to provide, to do outreach to the hotspots, to provide peer education, to distribute condoms, to talk to sex workers. If that's what the question is, then as we've said, sex worker organizations were really innovative. But the main thing that we saw, it was easiest for organizations that had peer educators who had a cohort approach and a micro-planning approach. So in other words, those organizations where one peer educator is responsible for, let's say, 30 sex workers, and those 30 sex workers might be in that district where they live. And normally they would go door to door and go and visit them at their houses. but they were unable to do so during COVID. But usually most of them had everybody's numbers on WhatsApp. And so outreach just moved online, basically. People started WhatsApp groups, and they would give them information, send them videos, informational videos, flyers, brochures, information online, but they would also do voice notes and voice calls. They would be able to tell them, remind them that this is the day that you have to go and get your medication. This clinic is closed, but you can go to that clinic. You know, all this kind of information as far as possible. I hope that answers your question. Over to Dorothy.
Yeah, so the question around sex work organizations in Eritrea, I'll probably leave ASWA to answer that. They're in a much better position to respond than I am. The question around rights-based economic empowerment. For many years, and this is pre the sex worker movement, pre-SWET and Sisonke and ASWA, and all the national sex worker-led organizations, even grassroots. The idea around economic empowerment for sex workers was based on a rehabilitation approach. So sort of give them something better to do, something more dignifying, something more moral, something that you can sell to people, so that this quote unquote sex worker is now rehabilitated to become a welcomed member of society. So so after several conversations with several sex workers, it has always been that given the numerous choices that a sex worker is provided with, I should say this, my name is Doti Ogutu and I am a sex worker. Given the numerous choices that I have had over the course of years that I have been a sex worker, however limited my choices were, it was a choice that I made. I didn't feel coerced or pressured to do it. And I could easily pick and choose when I want to go to work and when I don't, how I want to work and how I don't. And it's the same thing for several sex workers. Over the number of years, sex workers have now been empowered enough to identify economic opportunities that are preferable to them, that would supplement their income as a sex worker. As a person living with HIV, making that decision, and for a sex worker living with HIV, making that decision of what I want to supplement my income so that then I am not further exposed to STIs and other opportunistic infections is solely dependent on my choice. And therefore, when we talk about a rights-based approach when looking at economic empowerment opportunities for sex workers, it has to focus around the sex worker themselves and not around the idea of rehabilitating this person into the system. So it focuses on her right, her choice, her convenience, his or hers availability, and not something that is forced upon them. Yeah, I don't know how better to explain that, but if you look at several organizations in Zimbabwe, and this was done by the Power Group in Bulawayo, and I know Sweat and Sisonke are also doing it. There was a research actually that AIDS Funds, NSWP and ASWA collaborated in around 2012, and Grace was the coordinator for that. She coordinated that research, and it was the SUSO program, and it looked at economic empowerment for sex workers. So there has been documented evidence and stories and testimonies and success stories from sex workers themselves and from organizations that are running economic empowerment programs for people who are still very actively within the sex work movement and in sex work industry. And that resource is available with ASWA. So yeah, that's what I can say.
Thank you so much both for those wonderful answers to the questions. There are more questions and questions for you in the chat, in the function. If you could just please look at those and respond to the colleagues. Unfortunately, we've run out of time for this session and we need to move on. We still have that wonderful panel discussion to go through. But now I'd like to just thank you two gorgeous colleagues for the amazing work you did on the research. Thank you so much for gracing us with your beautiful presence. And next, we will go to Dr. Matali, who will just grace us with her closing remarks and, of course, blessing the meeting as we go forward. Thank you very much, Dottie and Maria. Over to you, Dr. Matali.
I hope you can hear me now.
Yes, ma'am, we can hear you. Thank you.
Yes, we can hear you.
Great. So first of all, colleagues, really apologize for the technical mishap I had this morning. But I'll just take a few minutes. To just give a few concluding remarks. And I just want to pick up from where I left. I just want to, at this point, that I've gone into the whole arrangement of this very, very important meeting. And also I know that we did have the presence of the UN AIDS regional director, Anne Gifuku-Shongwe, and really appreciate her presence at this meeting. And representation of this meeting really shows that it's really a broadly multi-sector meeting, very consultative, and really demonstrates the importance of the subject matter. Like we said, and I think we all agree, sex workers' lives matter. And from the UN agencies, and I believe all the partners, this is a testimony of our commitment of working together. As I mentioned in my earlier remarks, we've learned a lot from the experience of COVID-19, Ebola, that have been painful reminders about the vulnerabilities of all of us to pandemics and epidemics. And in addition, the humanitarian challenges such as wars, conflicts, and disasters which are common in the region, which tend to expose the importance of inequality in our communities. We live in a world of inequality, and those most marginalized suffer most when pandemics and humanitarian challenges strike. Now, the one during the COVID-19 pandemic was the role of civil society organizations. The leadership of sex workers organizations during the hard lockdowns demonstrated once again the importance. And when the study was undertaken, the idea was not just to confirm the fears that we had with regard to sex workers. The idea was really to try and find long-lasting marginalized communities, the sex workers. And I trust that this consultation and the review of the study allows us
We are facing internet challenges. We know that this is another big, reality we've come to face when, of course, working in the internet and through Zoom. Thank you very much, Ms. Dr. Matali, for gracing us with your presence. I see that you have issues with your internet, and we hope that you'll join us again on the last day as we close the meeting. Yes, thank you very much for the questions we've received so far. Please, as I said, type your questions for Maria and Dottie in the Q&A function, and they will respond to those as we have run out of time for that. We will be sharing all the materials, presentations, everything that we speak about on the at this platform. We will share those after the meeting. including the study that Maria just presented on, that will be shared with you. So don't worry about that. Without further ado, and in the interest of time, what we were going to do was allow you a bit of a break to get a sip of water. I think we will actually do that for the next 5 minutes. So it's 10:35 from where I'm sitting. Let's come back at 11:40 for the panel discussion with Charles. So go grab a glass of water, go use the bathroom, but please be back at 10:40 so that we can continue this exciting adventure that we just started on. Thank you very much.
How many times do I have to tell you? Even when you're crying, you're beautiful too. The world is beating you down. I'm around every move. You're my downfall, you're my muse. Your worst distraction, my rhythm lives. I can't stop singing, it's ringing in my head for you. Heads underwater, crying, waiting for you. You're crazy and I'm out of my mind. Say the words out so slow. Say the words of the love. You say I love you, and you mean it too. Those words when you say I love you, takes away all my baby blues. You say I love you, and I do, and I do, and I do, and I do.
Okay. Welcome back, everyone. I hope you enjoyed your break. And you have your tea and you have your water. I'll now hand over to Charles to take us through the panel discussion, different perspectives, same united voice. Thank you. Over to you, Charles.
Thank you so much, Lynette. Thank you for that. We will now move on to the next stage. Sorry for the inconvenience that we had before when our sex workers themselves were presenting, but I believe that is now sorted out. So we're going to have Joyce Adhiambo to speak next. She is a Sex Workers Academy Africa faculty member, and she lives positively with HIV, and she's proud of that. So Joyce, please, if you're set, the floor is yours. Joyce, can you hear me? Joyce, are you set? Joyce, please confirm that you can hear us and move on with the presentation.
I have screened Joyce's presentation for ease, if everybody can see it.
Yeah, I can see that. Joyce, are you there? Yes, I can see you're there. Please unmute your and move on. Joyce?
Charles, Charles, perhaps we proceed and we come back to Joyce again.
All right, that's fine. Martin, Lungile. Lungile is from Eswatini, Voices of Our Voices. Lungile, are you there? Lungile? Kumalo? Yes, Lungile, I can see you are there. Are you able to speak? We still can't hear you. Please, technical team, assist us here. Lungile, please unmute. Your audio is not working. Still not able to hear you. Let's try someone else. Joyce? Joyce, let's try Joyce this time. Joyce? All right. How about you, Martin? Martin Zimba? Are you able to speak? Martin? Martin? Joyce? Martin? Are you able to speak, Martin? Please unmute.
Hello.
Yes, yes, how are you, Martin? Yes, you're welcome.
Yeah, thank you so much.
All right. Yeah, go on, please, Martin.
So I'll just speak to the challenges that we had during COVID, as well as our responses towards the COVID pandemic. So Zambia was hit with the COVID pandemic around 2020 in March, and we didn't, as sex workers, we didn't even have any idea around the protection, around how we could look around prevent it also. So there was lack of information, there's lack of awareness around how to live around the COVID pandemic, because most of the information that was around was for the general public. However, with the high-level directives measures to monitor the spread of COVID coronavirus, police officers were reportedly harassing and abusing sex workers through parades and patrols, as well as arbitrary arrests and searches in different locations of sex workers. Most predominantly, these were happening around the border towns. Sex workers who were usually found in the border towns were the ones who were really harassed by the police. And in terms of us responding to this, on the corporate belt, we tried to have a dialogue meeting. And in that dialogue meeting, that's where we engage the police officers, but also we had to look at other stakeholders that we could bring on board, like the Human Rights Commission, Ministry of Health, around the promotion of access to health, because during this period, we didn't have enough delivery of services or tailored services for sex workers. So most of the facilities where we could live sex workers were closed down, and this meant that sex workers did not have access to these services. So we needed to bring them on board as well. So in this dialogue meeting, we came up with action points, and we also decided that around the protection of sex workers, we needed a commonality of understanding, and also that people could come to a space where they could understand that sex workers also needed protection around their human rights as sex workers. And one good thing that came out of this meeting is that we agreed with all the stakeholders that we brought on board that there was a need for sensitizing the police officers around the protection of sex workers and also the promotion of human rights for sex workers as they could conduct sex work. So we had to train police officers around 270 police officers who are trained within the province in terms of how to relate with sex workers, how to work with sex workers, even during night patrols, how they could protect the sex workers and around, apart from just not arresting them, but also protecting them and making them go to safe zones where they could practice safer sex. In terms of other responses, we also as an organization, through our ASWA graduates, we train peer promoters around the promotion of access to services, to health services, which meant that these peer promoters would lead other peers around accessing services where they could identify safe spaces and also link other sex workers to these services. This was around HIV access, HIV testing, and care and treatment services, and also providing nutritional support for these sex workers who are on chronic support, and also sex workers who are on treatment, because we realized that some of the sex workers could not take medication because they could not afford income. They could not have any income that would really help them to purchase their food supplements and all that. So in terms of our interventions, we wanted to provide sex workers with nutritional support as they could as well as they could access the services. So these peer promoters and together with the SWA 2019 graduates worked together in terms of linking these sex workers to the services that they needed. However, as an organization, we also had challenges in terms of responding to the COVID pandemic challenges, in the sense that we also realized that some civic leaders, national leaders could use sex workers as an entry point into them getting political mileage by using them to, at one point there was an article in the news where sex workers were termed as the drivers of the pandemic. So we worked around trying to make sure that our sex workers are aware about how to protect themselves from COVID, but also the biggest challenge was that we couldn't reach as many sex workers as we could because we had limited resources and also because we couldn't bring in other partners on board. And there was an issue of also social cash transfers, which sex workers were denied directly and indirectly, in the sense that there was no opportunity for them to be allowed to be even at the decision for providing those interventions or for designing those interventions around the COVID, responding to the COVID pandemic. So most of these spaces were denied by the sex workers as well as us as an organization. We couldn't also respond to many challenges that sex workers were facing at this time because there was a lot of human rights violation around sex workers in Zambia by then at the height of COVID. As sex workers were termed as the drivers of the pandemic, reason being that most of the clients that were coming from foreign countries, and because of some of the sex workers would solicit sex work from the truck drivers, so they were termed as the drivers of the pandemic, which brought a really a big label on the sex workers, in the sense that as much as they were accused of being the drivers, were now being demonized, were now being more stigmatized, in the sense that because of the nature of our work, we're involved with lots of clients and we're driving the pandemic higher. This was really nerve-wracking, and it was really a challenge, a big challenge, because at every front, be it in the public sector, be it in at community level, sex workers are being ridiculed, we're being harassed, being abused, or because self-identifying as a sex worker. So you attempt to be the COVID pandemic driver. So this was really a big challenge, because we need to normalize, we need to understand, to make sure that even community members understand that sex workers deserve their rights and we deserve the right to our choice of work. Yeah. So yeah, those were some of the challenges that we really faced as an organization, and also the denial of the spaces where we could even engage other state actors in terms of how do we respond to the sex workers' challenges that are facing during COVID. Because even just the supply of hygiene kits, free masks and everything, it was really a challenge. This is sex workers being denied source of income because hospitals are closing, and then because they can't make money. So where do they get these things to protect themselves? So in terms of protective wear, clothing and everything, it was really a challenge, but at least we tried to reach out to a few, but in the course of all that pandemic, were really cash-strapped and we were hand-strapped, and we couldn't reach to other sex workers as we intended. Yeah. Thank you.
Thank you, Martin, for your presentation. Thank you for enlightening us on what's happening. And we hope to interact with your conversation much more. Let's try Joyce once again. Joyce? Joyce, can you hear us? Unmute, please.
me know if I should also screen the presentation then when Joyce is ready.
All right. Joyce, are you set? Okay. If Joyce,
Perhaps you can move to Lungile. We'll come
Lungile,
back to Joyce.
can you try Lungile? Lungile, are you set? Lungile, can you try to speak? Can you still having the same problem? Still, Lungile, we can't hear you. Joyce. Yes, Lungile, try to connect through your phone.
Perhaps while we wait, Charles, for Lungile, you could just update us on what's happening with Martin's situation because he won't be able to join. Thank you.
All right, so it's unfortunate that one of our speakers called Mark Bogu Wakisonko, the Queer Sex Workers Initiative in Kenya, their offices have been raided by police, and so he will not be able to speak to us today. This is so unfortunate. These are some of the violence cases that sex workers are facing in this region. So he will not be able to speak to us. Sorry for that. Lungile, can you try? So Lynette, kindly assist here.
Thank you. Thank you very much, Charles. I think we are facing a few challenges from our speakers' side, and this is, oh, let me just push my video on. And this is because of numerous challenges, of course. It's audio issues from their side of from their laptops. It's not necessarily that the meeting organizers or the tech team from our side are unable to unmute them or screen share or open their videos. They are doing that, but it's on their side that we seem to have a problem. So what we're proposing actually, in order just to move things along, is that perhaps because we've heard so kindly from one of our panelists speaking to some of the challenges that they faced in their organization, hearing that from our second panelist that he is unable to join us because at current point, even amidst the challenges or the constraints that many sex workers are facing, we are still facing raids, we are still facing numerous challenges. What we're going to do, just to make sure that we are inclusive and we are actually hearing the voices of sex worker colleagues, is we will be moving these two presentations from our colleagues, Lungile as well as Joyce, to tomorrow morning. So that we give ourselves time this afternoon to perhaps speak to them and see how we can, rectify the challenges on their side in the audio. So I propose that we move along that way in order to save time and in order for us to get the program going, because we are running a bit out of time. What I'm going to do is I'm going to move on to the next session, which is a session that looks at how we are going to start strengthening. Remember what we're doing now. We've brought all the ingredients together. We've seen what we're going to be using. We've seen what we can't use in terms of making this beautiful soup. And now we are at the stage of now starting to put the ingredients together in order for us to see what sort of soup we're going to make. So we were anticipating another presentation on lived realities from Madame Sanyu Bate, but she's also experiencing a few challenges and will be able to perhaps join us a bit later. What I was going to do was to ask Ms. Nonhlanhla Xaba, who, if she's ready, to perhaps engage us in her presentation, which looks at the right to integrated services, lessons from East and Southern Africa region, looking at integrated regional vulnerabilities in terms of the work that the World Food Programme has been doing in food assistance for key and vulnerable populations. As we've heard from Maria in her presentation, the issue of livelihood and for food security came high in terms of the hierarchy of challenges that sex workers were facing. So we just want to hear from the World Food Programme what some of the issues or how they've responded to the epidemic and what some of their work has been. Ms. Xaba, are you ready to share your presentation and to speak to us? Thank you very much.
Hi, good morning, colleagues, and good morning, Lynette. Can you just confirm if you can see my presentation?
Yes, I can, ma'am.
Okay, great. So good morning, colleagues. Great to be here, and thanks so much to ASWA and UNFPA for inviting WFP. I think the presentation from Maria was a nice segue to this presentation. So I've been asked, for those who have read the report, you will see that WFP is referenced quite a lot in the report, given the work that we do in emergencies and also in the areas of food assistance for the most vulnerable. So my presentation is really centered around just to provide more insights on who WFP is, and also some of the work that we've done in the region in really advancing food assistance programs in cases of emergencies and also in some developmental context. So as mentioned, I'll provide a brief overview of WFP, though I think that most people in this call would, in this meeting, would know what we do, and also just highlight our role within the UN Joint Program, and also share some of the promising practices in the region from a WFP perspective, and just provide some advocacy opportunities or areas where we could strengthen advocacy in ensuring that sex workers are also integrated within humanitarian settings or even in food assistance programs. I'm sure most of you know, we're the largest organization working towards largest humanitarian organization working towards zero hunger. We also deliver food, cash, and food assistance in emergencies in countries like Mozambique, the DRC, Ethiopia would know some of the work that WFP does in those contexts. And not just do we work in humanitarian emergencies, but we also bridge the humanitarian and the development nexus by also supporting communities in really building their resilience once they've gone through emergencies. How do we then build better in those communities through resilience programs, working closely with national governments? And I think what really, what's the ethos of our work is that we target the most vulnerable and the marginalized groups, ensuring that we leave no one behind. So I thought it would be important just to also highlight how we contribute to the SDGs as WFP. So we have a global strategic plan that is actually being revised this year that really looks at the two SDGs that we contribute to as an organization, which is ensuring, supporting governments in ensuring zero hunger, SDG 2, And then the second one is SDG 17, where we work through partnerships in ensuring that hunger is addressed in most countries globally. On the zero hunger one, there's a lot of interventions that we do within that stream. So it's really food assistance in emergencies, nutrition support programs. Some of you would know WFP's work in school feeding, where we support children in primary schools by providing school feeding. And in certain cases, we also have what we call school-based programs, where we integrate health programs within the school environment. And then how do we then fit in within the UNAIDS arrangements? I'm sorry if I'm using the old slides. I know that now we have the new political declaration and the new strategic plan. But what is important is that WFP's role within the UNAIDS Division of Labor hasn't changed. So as WFP, we work very closely with UNHCR in ensuring that HIV is integrated into humanitarian settings. So that's one of our key responsibilities within the UNAIDS Division of Labor. And then secondly, we work very closely, we collaborate with the ILO, International Labour Organization, in ensuring that we support governments in designing and also ensuring that they have their social protection mechanisms take cognizance of the vulnerabilities that are brought about by HIV. So not just looking at people living with HIV, but also looking at people that are at risk of HIV and also people that are affected by HIV. How do we make sure that social protection mechanisms are cognizant of this and also integrate all those vulnerabilities in their design and also in their execution? So now we have the Global AIDS strategy, which really is built around addressing inequalities. As WFP, we have placed our role in really pushing strategic priority 3, and I think for the reasons that I've highlighted, because we are co-leads in humanitarian settings, so ensuring that HIV responses are integrated in humanitarian settings. So if there's emergencies, coordinating with other actors on the ground and ensuring that HIV services are available and also accessible during those times, and also working closely with the ILO in really pushing HIV sensitive social protection mechanisms in the countries. So this is just to share on how we see the Global AIDS strategy, on how we can contribute towards it. The strategic priority 3 is what really speaks to us, but as WFP, we also contribute to the other strategic priority areas. And then maybe coming back to the discussion of the day, I wanted just to highlight that you would have noted that in the study that Maria led with colleagues, there was a lot that was quoted, or there was a lot of, I think WFP was sort of referred to quite a lot as one of the agencies that really support on the areas of food security, and again, in terms of livelihood strengthening activities in some settings. So WFP's programs, our food and cash assistance programs, just to highlight that they don't necessarily or explicitly target sex workers. However, if sex workers meet the vulnerability criteria that has been laid out in those contexts or in those countries, if they are food insecure, they definitely can access WFP safety nets and food assistance programs. Why do I say this? We don't discriminate, but we work very closely with governments, I think, as other UN agencies would attest to this, in defining those vulnerabilities. And what we found is that in some contexts, if sex work is criminalized, then governments are not likely to include sex workers within the vulnerability setting criteria. But I think there are opportunities for us to advocate towards that, which I'll share towards the end of my presentation. So also just to also highlight that, like when an emergency hits, when we're approaching a lean season, which is a season where there's high levels of food insecurity, we will work closely with government in determining which groups will be vulnerable, what eligibility criteria would be used to target those populations, and also in really designing the size of the transfer within those contexts. So having said that, I just wanted to just highlight some of the, I won't say success stories, but some of the interventions or some of the initiatives that we've seen as a result of COVID that have shown that it is possible to integrate sex workers within our programs. One of the programs I like to highlight is the Zimbabwe Urban Cash Transfer and Resilience Building Program. So this program was started in 2019 as a project to meet food needs of those who were most food insecure in the urban settings. I think one of the things we're seeing is that poverty and food insecurity is no longer an issue that we see in rural areas, but there's a lot of poverty and food insecurity also in urban settings, and hence we're seeing a lot of our programs moving away from rural areas but being implemented in urban settings. And this also speaks to this program which was started in Zim in 2019. So when COVID hit in 2020, obviously, I think as colleagues have highlighted, there were lots of restrictions and lots of lockdowns that negatively affected the informal labor market. So WFP, working closely with the Ministry of Public Service, Labor and Social Welfare, came together and sort of expanded that program that was mainly looking at the unemployed and people living with HIV and or disability to include other social groups in urban areas. And within these social groups, we saw the inclusion of street vendors whose livelihoods were affected. We also saw sex workers being integrated into those programs, widows, orphans and vulnerable children, are also people living with HIV, with disabilities, and people living with HIV are still part of that program. So in a way, I think this program really shows that there are, working close with key ministries, with key national actors who understand these vulnerabilities, there is a way to integrate sex workers into our programs. Since the program started in 2019, we have to date reached about 326,000 beneficiaries in the 26 towns. When the program started, especially for the sex worker inclusion, it was mainly in Epworth. Some sex worker organization working in Zimbabwe would know that Epworth is the epicenter of sex work in Zimbabwe. So, but we have seen that even in some other smaller towns, we are really reaching out to sex workers. Maybe on the transfer, it's a voucher transfer program where sex workers get, I think monthly they get about $12, which they're then able to redeem at certain retailers and buy whatever commodities that they'll need. Sorry. And then secondly, I thought I'll also just share on some of the work that we're doing in Mozambique. Maybe, but just before I share, in Mozambique. Sorry, I just jumped a slide there. So in Mozambique, we work closely with the North Star Alliance. Those who know North Star Alliance, they're very popular with the Blue Box model, where they target the busiest transport corridors and provide sexual and reproductive health services for mobile populations. So in partnership with WHO, UNICEF, and IOM in Mozambique, this is part of the UN Joint Team Program in Mozambique. We are currently supporting this initiative in Nchope, and this was really, we were actually approached by North Star Alliance because they are the runner of the Global Fund in implementing these projects, and we sort of thought that in terms of the target group that, in terms of the groups that are targeted for this program, they really speak to, addressing vulnerabilities and also ensuring that those who are left behind and also people on the move are catered for under these services. So the initiative really, the objective is really to provide sexual and reproductive health services. So within these blue boxes, they provide HIV testing, treatment services as well are also provided, mainly targeting sex workers, truck drivers, and also adolescent girls and young women within close proximity of these blue box clinics. What we've seen is that there's beyond just the services that get provided, there's also a lot of peer support groups that are run as part of the clinic activities, focusing on sexual health issues, focusing also on nutrition. I think WF is very big on that one, provide a lot of that, of those interventions, and also just also ensuring that the groups that are targeted have the right information and also are able to access all the services. Earlier this year, we've also tried to explore how we can enhance the livelihoods of sex workers that are that are sort of servicing this Inchope area. And we have been engaging with some livelihood training institutions to come and provide some support. At the current moment, we're still looking for funding to see how we can enhance this. And this exactly came about when COVID hit last year, and most of the sex workers' livelihoods were impacted, and we started to engage them to see how can we enhance their livelihoods by bringing in some organizations that can train them into in some skills, whether it's sewing or any other skills that they can use to sustain their livelihoods beyond just sex work. And then also other opportunities that exist. I think this is something that we had discussed with Innocent and Lynette, that WFP supports government in conducting what we call routine food and nutrition security vulnerability assessment and analysis. And how this information helps us is that when a disaster strikes, we're then able to assist governments in their targeting criteria to identify groups that will be most vulnerable to food insecurity when there's a drought, when there's an emergency, for instance. So I think this is also an opportunity to ensure that when sex worker organizations work in countries, they work closely with these groups, which you call in each country, they are called vulnerability assessment committees. And they're really made of food security experts, and also some now we've seen over the past years, we've seen like HIV experts also coming, technical experts coming into these groups, nutrition experts coming into these groups, and also gender experts, just to highlight the impacts that food insecurity could have on HIV affected families, on nutrition as well of the population, looking at children and women, and also just general gender, and also on women. Women could be adolescent girls and young women, how those emergencies could have an impact on those groups. So this is another way which I think would like to propose that could be a way of really seeing how we integrate the vulnerabilities of sex workers into the broader national discussions on vulnerability within the countries. So what could be beneficial with those groups is that they have various tools on food security indicators, which we can then modify to reflect the sex workers' context and also reflect their vulnerabilities. As WFP and other food security experts on stakeholders, this is something that we could support in terms of the data analysis. And the results could then be used to raise awareness, influence programming, and even advocate for change in those contexts. And then maybe in my last slide, based on what I've just shared, was then maybe just to share some ideas on how we could contribute to some, not contribute on what are some of the advocacy actions that one could put on the table for consideration as we move the agenda of the integration of sex workers into the food security analysis and assessments that are done. So what we would like to put forward is that we need to strengthen the data collection and analysis of the vulnerabilities faced by sex workers. What we found is that if we have reliable and routine data that's always gets collected, it then becomes easier when programming is done to really push for the integration of these groups, because we already have reliable data that we can use to influence and also to advocate for their integration. And also, just as I mentioned, I think we have the VAM structure or the VACs in the countries where which we could use to integrate food security indicators into these routine assessments. So if we do routine assessments around access to services for sex workers, I think it will be important to also integrate some food security indicators so that we can constantly have this information about how is their access to food security, how are their livelihoods impacted, such that if there's an emergency, we already have this data which we can use to influence change. And then we can also advocate for the inclusion of sex workers' vulnerabilities within the VACs, as I've just mentioned. And also another critical player will be our disaster risk management authorities. I don't know what, they have different names in the different countries, but these are the decision makers in most of the countries which determine which groups are vulnerable and what kind of support needs to go to each group. So these are key players at the national level, which we really need to engage with. And then lastly, it's really around the inclusion of sex workers as a vulnerable group in social protection mechanisms. Most governments have these and they're able to scale them up either horizontally or vertically in times of emergencies. So if sex workers are already integrated into these social protection mechanisms, then it becomes much easier to when the disasters hit or emergency hit, to scale up these interventions and ensure that they are also included within this. That will be my last slide, Lynette. Back to you. Thank you.
Thank you so much, Mkanka. We truly appreciate that, the wonderful work that WFP has been doing. I'll just hand over to Charles to do the comments and Q&A section. Thank you.
Thank you so much. That presentation is very wonderful. I've picked quite some good points, like strengthening data collection and analysis of the vulnerabilities faced by sex workers. Those are good points that I've carried home. So I want to announce to you that all the presentations will be sent to your emails. So feel that you get all the presentations. Yes, and that is the purpose for this meeting, is to share knowledge, and we take that knowledge to the grassroots. So you will get the presentation. Some of your comments on the chat box is that really encouraging to see how WFP has already integrated into the global strategy. Yeah, that's encouraging. So we will if you have any questions, so I want to open the floor and ask you a question, and then it's going to be responded to. Kindly take the floor and ask any question that you have.
Hi, Charles. Sorry, it's Lynette here. I thought it was very important to mention the fact that Maria where
Yeah.
Pira has just said that our members in Epworth are beneficiaries of WFP Urban Cash Transfer. Thank you very much for that. And maybe you can actually speak a bit about the Urban Cash Transfers with us and just, give some context around that, Nhlanhla. Thank you very much. Tendai is saying that he is encouraged by how WFP has already integrated into the global strategy on AIDS in their programs. And he's very encouraged. He's particularly interested in working with WFP. And he's also saying that, of course, he would love to have your presentation, which he will have. If you could just speak a bit on the cash transfers, we'd really appreciate that. Thank you.
Thanks, Lynette, and thanks, Charles. My apologies. I thought my camera was on all this time. Sorry. Yeah. So on the project in Zimbabwe, just to indicate that I think when I was making my introductory remarks, I did indicate that as WFP we don't explicitly target sex workers, but this has been as a result of national actors in the country identifying which groups are vulnerable in urban settings and pushing forward the need to really support the sex workers. Actually, one of my colleagues who's the PIAS, who's the project coordinator for our urban program, highlighted that they also did some assessments as WFP in Zimbabwe, just meeting with all informal workers within urban settings when COVID hit. And it came about that within the meetings that they held, sex workers were also presented there, and they voiced the challenges that they were meeting in sustaining their livelihoods given the context of lockdowns and also not being able to meet their clients as regularly as they could. And within those meetings, they also had representatives from the ministry. Hence, I was saying that there's a lot of advocacy that needs to be done with key government ministries and other actors and even funders, for instance, because part of this project is funded by the CIS Development Corporation. I should have mentioned that. And some donors really understand and also are receptive of all vulnerable groups. So it was easier for WFP and also with the ministry to really push for the inclusion of these groups. Just to also mention that this project is linked to a resilience building project. So it's not just the cash transfers only, but also some of the sex workers are also engaged in resilience building activities. Some of them are also engaged in poultry projects and other projects that have been initiated to really ensure that the project is sustainable beyond just what WFP is providing now. Back to you, and thanks for the positive feedback from colleagues. Thanks.
All right. Thanks for that. There's a question. There are some questions on the chat box before you leave. Someone is asking, what has WFP done regarding capacity building for sex workers to get alternative means of livelihood? And also there's another one. Someone is saying, thanks for the good presentation. Do you think the measures that were taken to mitigate the livelihood of sex workers can be sustainable? You can start with those ones, please.
Yeah. So I mean, I think what I said in the beginning is that we have a lot of resilience building activities that don't really seeks to strengthen the livelihoods of the vulnerable groups that we work with. So I wouldn't say we've targeted sex workers per se, maybe just looking at the question around alternatives means of sustaining the livelihoods of sex workers. But if those sex workers are within our programs in the different contexts where we work, they will definitely be engaged in our resilience building activities, which are really to go beyond the emergency response type of interventions, but looking at how do we then sustain people's livelihoods and ensure that they still have the work that they do on a normal basis. And then the second one, I as some of the opportunities that exist in terms of how do we strengthen this. I think for WFP, it's just a start, but then we've got a lot of lessons to learn from our Asia Pacific colleagues. Lynette and Innocent would know some of the experiences that have come through from our Asia Pacific colleagues, where they've been really pushing for the integration of sex workers into safety nets and other social protection mechanisms in those contexts. And I think for them, the environment allows. So sex work in some contexts is not criminalized, but within our settings, probably in East and Southern Africa, we still have a lot of challenges to really push against the criminalization of sex work. And given those limitations, I think the opportunity exists for us to position sex workers as a vulnerable group within the structures that I mentioned. Like if we collect routine data on the food insecurity situation of sex workers and their families, we can then position them within our vulnerability assessment committees. And then when a response is planned, food security assistance program, we can ensure that they're also already integrated. I don't know if I answered that appropriately, but that's just my thinking. Back to you, Lynette.
No, that was great. Thank you very much for that, Nhlanhla. You've given us great food for thought, especially what to include in the framework that we're going to be building, and what we can do to support, internal advocacy at WFP to ensure that we have these assessments done routinely and integrated into your work program. I have one question actually around, and it's a very broad question around, the element of human rights, food security, and who is selected for food. So for instance, how vulnerable must you be? Must you look like Schmeagol from Lord of the Rings in order for you to be considered vulnerable? And just because you identify or you want to be a sex worker, you then kind of like get sidelined. That is a very critical factor that we need to consider around the issue of criminalization. We've got a question that's not going to be helpful for you, I think, but that is food for thought about how we're working with governments. And it says, Zambia just came out of a presidential and general election plus COVID. What did this do? Well, how has this affected your program? And then we've been asked about your geographical coverage in Zambia as well. So if you could just answer that, I'd really be those two questions actually, in terms of how do we prioritize people, like especially for food security. Must you look a certain way? Must you be vulnerable? Because you're not necessarily a person first, and then you identify as a woman or a man or a child. And then thirdly, it's what you do for work. So in those instances, can you just, kind of like, that's what I'm grappling with as a person. Can you just answer that? And then the second question around how you've been prioritizing, especially in Zambia, the country. Thank you.
Thanks, Lynette, and thanks for those questions from the colleagues. So in terms of how do we prioritize, I will say this again. So we have some tools that are used in most of these countries. So most of this work is really government-led, colleagues. I really want to stress that. WFP just supports the countries in executing these assessments. So what would normally happen is that, like for instance, they would focus on urban areas and rural areas. So some of this is very granular. So they'll go house to house and ask a series of questions. If I recall, some of those questionnaires take about 45 minutes to about an hour, 30 minutes in each household. So they have like data collectors that go house to house and ask questions. And then the area will then be classified as a food insecure area. So it would be, let's say, maybe I'll make an example from the township where I come from, which is Umlazi in the east side of South Africa, in the east coast of South Africa. So, for instance, they will go maybe to Umlazi as a township and do the vulnerability assessment, asking these questions. Maybe they'll have like a they have a protocol on how many households they should be asking. And then those houses which have been asked these questions will then be aggregated, and they will say maybe section A, B, C, and D in Umlazi Township is food insecure. And then the food support will be targeted to those areas that have been found to be food insecure, not really individuals, Lynette. So it's mainly a food support or a food assistance program that targets an area that's food insecure. And they will take into cognizance how many households are there. Maybe it's 5 households, and we know if it's not 5 households, maybe it's 500 households, and you know each household maybe has 5 people in it. And then the food assistance program will take that into cognizance if they provide support. So if within the household, if within those settings, there's sex workers, there's people living with HIV, there's people with disabilities, then all those people will be catered for with those interventions of food assistance. So that's one. And then in Zambia, so our programs in Zambia, we don't have a very strong HIV component. Our programs really center around nutrition support, and also we work a lot with government on the school feeding program, and also some of the work was around refugee support in the north, if I remember correctly. So we don't have a very strong HIV program in Zambia, so I wouldn't be able to speak to the impact that that COVID or the elections has had on our programs. But I think there's an opportunity to engage our country office if you are already working in Zambia to see how they can support some of your programs. Because I think as the ethos is one, really reaching, leaving no one behind, and also working closely with the marginalized populations. Back to you, Lynette.
Thank you so much for that. That was perfect, actually a perfect segue into our next presentation. We appreciate the wonderful work that WFP is doing, Nhlanhla, and we will definitely keep engaged with you colleagues in terms of how we work together towards the 2025 targets, and more broadly, how do we get to 2030 as a collective. Our next speaker actually has just joined us with Maria Dotti, is the coordinator of the African Key Populations Expert Group, AGPEG, and she will be presenting on behalf of UNDP, focusing on towards the Sustainable Development Goal, working with governments to advance the SDG agenda and efforts to protect sex workers' livelihoods, human rights, and health. Thank you, Dotti. Over to you.
Thanks, Lynette. I only have 20 minutes, and I have like 50 questions for our colleagues at WFP, so I'll probably pick her brain at a later stage if contacts are shared. So I played around with the title of my presentation, and I mean, looking at SDGs and how sex workers have been able to make it work for them, or in what ways the sex worker community have been impacting, however minuscule or grand, their projects and the program implementation that sex worker organizations are implementing across East and Southern Africa. So that will be the scope of my work. Just a little bit of background information about the ACPEG, the Africa Key Population Experts Group. We're a group of leaders. We are not a regional network. I should say that, disclaimer, of key population leaders across Africa. So, and our membership really varies depending on time, and whatever project that we're working on at a given moment. So between 25 to 40, sometimes gone a bit higher when we bring external experts from other regions. And I would say we do engage a lot with the Asia Pacific network of key populations.
Dotti,
yes?
excuse me, I apologize for disturbing you. Can you speak closer to the mic? We can't hear you. Thank you.
I can actually increase my, is this?
Oh, yes.
Low.
Oh, yeah, perfect.
Something keeps reducing my volume. I don't know why. Okay, I'll keep it there. Is that better?
Now it's too loud.
Okay.
Perfect,
now?
Perfect, yeah.
Okay, great.
So, and then our mandate really is around policy. So we focus a lot on policy issues that are affecting key population, mainly being around HIV and SRHR implementation that affects key populations. And we do that through advocacy and stakeholder engagement. One of the key things that we've been able to successfully do is engaging with the regional economic communities in the SADC region and also in the West Africa region with the drafting and the adoption and ratification of the key population implementation strategies. I mean, a number of key populations were involved in those processes. We also engage with other UN agencies, I mean, UNFPA, working very closely with UNDP on issues like this, particularly around sex work, other civil society organizations. And so far, one of the main areas that we do engage is around research. And that's how I was able to work with Maria on this rapid assessment. So, I mean, SDGs, we all know about the 17 goals, and there are quite a number with very many targets. But then I picked a few that I felt that really you could see tangible evidence that sex worker organizations, sex worker communities have really impacted and are doing significant programmatic implementation and significant input into the lives of sex workers, and these are contributing largely to the attaining of the Sustainable Development Goals. It would be good to go over all of them, but these ones are the ones that actually spoke very loudly. So around goal 1 and the issue around ending poverty, and we've spoken about this, I mean, Maria spoke about this, and also the person who spoke just before me from World Food Program, is around economic empowerment programs for sex workers, providing alternative livelihoods for sex workers. Over and over, sex workers keep on insisting that they, it is always good to have another source of income. And this is because of the nature of the criminalization of sex work, and really emphasizing on not it being rehabilitation. And this is also not the Swedish model that promotes criminalizing clients of sex work, because you're literally taking away their income from sex work. And that also extends to third parties of sex workers. These are people that keep sex workers safe. Sex workers need to hire security, and therefore by criminalizing the third parties of sex workers, you're literally taking away their social support and support system. And obviously insisting on a rights-based approach. So, I mean, I would really encourage colleagues to speak to ASWA about the research that was done in 2012 around, providing alternative livelihoods for sex workers. Goal 3, which speaks around ensuring healthy living and promoting well-being for all and at all ages. I mean, this talks about, we all know, I mean, HIV prevalence among sex worker communities is sometimes double or 3 times the general population prevalence. And therefore sex workers need to be core at the center of the discussions around access to HIV and STI treatment care and support. And to a very large extent, that has already been happening. And therefore, I mean, organizations of sex workers at national level keep on wanting to engage with their national AIDS control councils, with the bodies that regulate HIV and AIDS, to be able to influence the program implementation and the policies and how the programs are really run at a national level. Again, access to a holistic and comprehensive SRHR services is something that is very important to this goal, ensuring that this includes not just HIV and AIDS and STI treatment, but contraception, abortion, prevention of cervical and breast cancer, post-abortion services, prenatal, postnatal services. These are very important services that are often left out. And sex workers are not able to engage. So you would find also sex workers have been within drop-in centers, they focus on these services, but this can also be done at a very large scale with the involvement of government, with the involvement of other development partners. And one example actually does come to mind about the Mothers for the Future initiative for sex worker mothers and their children. This is done in Sweat, in South Africa by Sweat and Sisonke. And it's been very powerful because they're able to really look at a holistic person who is the sex worker and what are the needs that they have. And then, of course, engaging sex workers in health financing conversation. You cannot emphasize this anymore at national, regional, and global levels. Goal 4 looks at the quality of education, capacity strengthening program for sex workers. There was a question, I could read that question in the chat. And this is very important. One of the reasons why ASWA has continued to grow and expand into the 34 countries that Grace mentioned is because of the ASWA Academy. The SWA Academy is an integral part of ensuring sex workers' capacity is strengthened and that they are informed about issues that affect their lives and how they can also go back at national level and input into those processes. And we have partnered with UNFPA in the past in 2016, where we actually did a capacity, we did the academy with additional members with support of UNFPA, and we thank you for that collaboration. Goal 8, looking at decent work and economic growth. This is actually very important because it really goes into the core issues around sex work and sex work being criminalized, and therefore constantly advocating for the decriminalization of sex work, emphasizing that sex work is indeed work. I think that's the one slogan that sex workers shout very loudly. Unfortunately, it's falling on deaf ears. And I mean, the ripple effects of decriminalization of sex work would lead to protection under labor laws, and this would ensure that sex workers have a safe and a secure working environment, equal pay for equal work. There are endless testimonies of sex workers not getting paid after providing a service. So with decrim, these are some of the positive ripple effects that we would get. And one of the ways that we've also seen practically sex workers really advocating for this is from a strategic litigation case that took place a couple of years ago in South Africa. This is the Kylie case. And really and one of the outcomes of that case was that sex workers have access to labor rights. And that in this particular case, the court actually ruled in favor of Kylie. Yes, and I mean, speak to our colleagues in South Africa, in Sisonke and Sweat, and they can tell you more about that case and they can share the case study. Goal 10 that looks into reducing inequalities, the advocacy work that sex worker movements have been doing around non-discrimination and gender-affirming laws for male sex workers and transgender sex workers, social integration and promotion of equal opportunities for all. So the question, when our colleague from WFP spoke, is like, after all the evidence that you have seen and we have presented over the number of years, what does it take for sex workers to be classified as a vulnerable group, right? So that's just food for thought. And it was during the COVID crisis actually that, and Maria shared the photo earlier, was this initiative by ASWA and ASWA, actually them mobilizing from the sex worker community and contributing to the Kenya Red Cross to provide relief food for their communities. And that actually speaks to how much innovation and how much commitment came from a community that really felt that our needs were not being addressed and that they needed to take that step forward and go to a humanitarian organization and say, you know what, there's this group of people and you have the reach, you have the reach across the country, we have mobilized this much, we want you to reach our people. And that really was a very powerful statement by ASWA and KESWA. Goal 11 around sustainable communities and cities. Safety and security, the thing around sex workers being evicted because they couldn't pay their rent because of COVID. The issue around sex workers not being able to access public transport because the fares have been hiked and therefore they can't go to the healthcare facilities. And as a result of that, they fall off the cascade of treatment. As a result of that, sex workers die. We need to work around that. And some of the way that I remember ASWA did their Changa, which is a local fundraiser kitty thing, is that they were able to raise money that would then be given to sex workers, or they even went ahead to support payment of housing that would ensure that sex workers are not sleeping on the streets, right? And adopting policy that would provide social protection for sex workers, you know? So on a community level, this community-based organization are already doing that in some sort of sense, but that needs to be rolled out on a multi-level scale, at a national level scale. And this is actually the role where government and other development partners come in to support that type of work. And then goal 16, peace, justice, and strong institution. Access to justice and promoting the rule of law and non-discrimination environment. We have seen several occasions where, you know, cases are being taken to court. And unfortunately, some of this don't get followed through, but we have begun to see another piece of work that ACPEC was also part of, was a regional grant that was being implemented by UNDP. And this was around talking to magistrates and judges around some of these issues. It was a broader scale around HIV, but also the fact that it was a key population grant from the Global Fund. It was an opportunity for sex workers to present their case, for key populations to present their cases, for the magistrate to look at them from another lens. And these are ways that, you know, sex workers are continuing to engage in, you know, at that level of promoting justice and ensuring that this justice is served for sex workers who have been violated. Meaningful participation for sex workers in issues that are related to them. I mean, one of the key slogans that we've had across the movement is nothing about us without us. We want to be involved. We want to be part of it. So even in the crafting of penal codes, really, there should be a process of engaging at a community level and hearing from vulnerable communities and hearing from communities that have been criminalized for decades and centuries. You know, access to information. Martin presented when he said that they really didn't have information around COVID. And that's why ASWA came up with a flyer. HOTSAS had a flyer, so that then this information is tailored for this particular community and it reaches to them. And finally, on goal 17, partnership for all the 17 goals, you know, and development partners, this is a call really for development partners to keep sex workers informed in spaces where they can engage at national level. There's so many processes happening at national level and sex workers are left out of those conversations. I was in a space with ASWA and KESWA a month ago or two, and there was a conversation around climate change, and women were brought into that space, but sex workers weren't. Why? Climate change affects everyone. So that's something else. But we've seen partnerships by sex workers and feminists. You know, there's a sex worker all-inclusive feminist alliance that exists. And it's because feminists have been non-supportive to sex workers, but now they're feminists that are actually coming out to say that we support sex worker rights and the agency that sex workers hold around bodily autonomy. The Sex Worker Donor Collaborative is a platform that brings together donors, and the organization I work for, Frontline Defenders, sits on this platform, and it's really to speak to other donors to inform them that, you know, funding, Maria spoke about how funding is very limited for sex workers and key populations. And therefore, this is a call to other donors to, you know, look at the issues, look at the human rights violations around sex workers and how can you contribute and what fundings do you have that we can put together and really channel them to reach sex worker programs. And also the inclusion of sex workers within the broader gender-based violence movement and adoption of decriminalization of sex workers is one of the strategic objectives in the South African National Strategic Plan on gender-based violence and femicide. I mean, there are multiple ways of partnerships and I hope that within my presentation, I've been able to share different opportunities, different cases and scenarios across the region, Eastern Southern Africa. And I mean, of course, also West and Central Africa, where sex workers are really struggling to implement projects with very limited funding, very limited support. And what they do need in that particular scenario is just your partnership, you being able to engage with them. And I even think for this, report, it is very good, and I really applaud UNFPA for how far they have gone to really disseminate this report and engaging other stakeholders in this, and you know, the participation even in this webinar is something that really talks about the commitment of UNFPA in partnering with sex worker programs. And I will stop at that.
Wow, Dottie, that was quite a lot, but you already gave a lot of solutions, which is, I think, what is important at this stage. You've given us, you know, kind of like some of the challenges. You've given us how those challenges have been resolved through a social partnership model of sex workers, as well as how all of this aligns to the SDG goals. I think what we have been leaving behind has been, you know, kind of like silo work in terms of our programming, not only for sex workers, but for all other key and vulnerable populations in the work that we've done in the last decade. Even with the Millennium Development Goals, we missed that. And that is where we are trying to kind of like weave that integratory approach in the SDGs. What a question I wanted to ask, actually, I'll take the liberty as a facilitator, was that in terms of international level advocacy around SDGs, have you seen a lot of sex workers play a vital role in that, especially in some of the meetings that have been held? I know for a fact that there were interventions around the HIV, UN, HLM, and that is because, of course, in many contexts, sex workers are already classified as a key and vulnerable population, so they are grouped as that. But within the SDG context, have they been engaged? And also, do you know from your knowledge, in terms of the broader COP26, the environmental aspects, have sex workers been engaged at a global level? I know at a regional level, you mentioned that at national level, it's not happening. Has it been happening at a regional and continental level from your expertise?
So my answers are yes and a no. So yes, in terms of when I say the ACPEG works on policy issues. So one of the things that we very deliberately did in one of our gatherings, and we haven't been able to do that once COVID hit, so we've been meeting virtually, but was in one of the, and this was actually a very easy task for me, because our very last meeting with the ACPEG members, we had sat in clusters according to key population group. And so I really just went out and pulled out that report that we had done in 2019, where we really spoke around how do we make SDGs work for us as a community. So trans people had their opportunity to do that, and the group of MSMs and the drug users as well. And unfortunately, one of the things that came out from that process is that the sex workers said that at national level, they are not engaging. And that was their very first time of really interacting with the SDG goals. So, and that was a moment of, you know, of just realization of how many opportunities are there, even at national level. So my last point around requesting development partners and UN agencies, because some of them do actually know when these processes are happening. It would be good to let your national counterparts know how to engage at national level, because at the end of the day, the buck stops there, right? So at regional level, it would happen. It has happened during our conversations with the RECs, and we really tried to push a lot of change within the policies around HIV implementation. And unfortunately, for key populations, it's limited to HIV and SRHR implementation. But slowly, there's a little bit of pushback. And also I think with the global networks, they are also pushing back a little bit of not just letting us engage in HIV conversations, or like in goal 3 around goal 5 on gender equality, right? Because then we are limited just to that. But on a broader scale, all the goals really affect each and every person, right? And therefore it's upon a particular community to seize the opportunity within a particular goal, but you also need to be aware of when that opportunity is available in your country for you to be able to take part in. Yeah.
I mean, again, just a question from my side is at country level where you're already criminalized or where you already don't have access to resources and aren't part of a movement, it's very difficult for you to engage, right? At a regional level, it seems to be easier if you are part of a global, a regional network, such as, for instance, ASWA. So it's easy for you to get in places where the RICs are. At national level, are there entry points with, for instance, groups like the Global Fund, or how am I as a sex worker at a national level who doesn't know anything, who's not part of a SWED or an ASWA, how do I start engaging actively in these processes to make sure that in the SDGs, whichever one I'm working in, I fit into that process? Yes, that's what I'm asking, because I don't think it will happen with the UN agencies, because sometimes it's not as easy as emailing somebody at the UN to say, hey, whoever, can you include me in the process? But how do we identify it at a national level? Thank you.
Yeah, global fund processes and the COP processes are really important spaces for one to engage. But then again, you'd have to be part of a movement, part of the network within your country to be able to be aware of these things that are happening at a national level. One of the things that has really strengthened the sex workers movement is the issue around representation. And therefore, by the time you are in a platform, you're not just speaking, I'm not just speaking for me, Doti, the sex worker. I am speaking on behalf of a community and a constituency that is expecting me to raise critical issues that are affecting us on the ground, and vice versa. Whatever policy issues that are being passed or ratified or implemented at national level, you should be able to take that information back into your community and really outline how that then impacts on your day-to-day, on your programmatic work, etc. And yeah, so I mean, the national networks, and I would say ASWA has really focused a lot through the academy, strengthening national networks across Africa, really so that then they are informed about the national processes. I still see that the UN agencies have a responsibility, if I can call it that, to inform, their communities that they work with. So, I mean, in this case, because I know UNFPA are the ones that would be set aside to work with key populations, right? Because as the ACPEG, we get a lot of our information from UNDP, which is, and it's forwarded from UNFPA, what involves sex workers, and then ACPEG would forward that to sex workers in the region, and then from UNAID, and that it's forwarded to key populations in the region. So I still see that that's the responsibility, and ACPEG exists there to be that conduit. So because the work that we do is really supported by the UN agencies and the UNAID's co-sponsors as well. So there is an opportunity there. And for the sex workers in the region, I mean, we would then feed our information to ASWA so that then it gets to them for them to issue that information to their membership. And that's how we've really worked since 2014 when we started.
Thank you very much, Dottie. We've got a question from Mahari for you, and that is, how do you, and this is a very, such a difficult question. How do you think sex work decriminalization can be achieved in societies that really totally denounce it? I don't even know. Yes, Dottie, how do you think? How do we do this, Dottie? And we're looking at Mozambique, who has done it, right? So how do we follow suit? Please give us some words from the wise.
This is the very interesting thing when it comes to having a conversation around sex work, when it comes to having the conversation around homosexuality, is because everyone wants to hide behind this moral curtain that actually does not exist. I will give you a scenario. So in Kenya right now, we have a lot of social media influencers who are trans, who are cross-dressing, who are gay, who are sex workers, and guess what? Brand ambassadors are using them to
Your mic, you need, sorry, your volume just ran away.
Okay. Okay. Better? Yeah. Yeah. So I was saying trans, gay, cross-dressers, sex workers as are influencers in social media right now. It's like a big thing. But no one is, brand ambassadors are using them. I don't know why this keeps happening. Sorry. Brand ambassadors are using this very people to sell their products. And people are buying because there was a cross-dressed man in a wig, right? And selling makeup. But when it actually comes to standing by these communities when issues are actually happening, no one does that. And that's actually what happens during election time, is because then someone can automatically ride on the issue that, oh, all those gay people are pedophiles. All those sex workers are immoral women and we must banish them, and things like that. When we are actually required to step up and defend our communities, and even for us who work behind civil societies, we don't do that. We don't do that because I'm a member of this church and it's not allowed. And that is wrong. We need to start holding each other accountable when we're having conversations around decriminalization. I don't think decriminalization cannot be achieved. I think it can. And it can if people can begin to walk the talk, as opposed to, writing beautiful documents and with very beautiful recommendations from UNAIDS and UNFPA, sex work should be decriminalized. But when it actually comes to the time that it makes the make or break moment, no one is standing by the sex workers. Right now, we have a very powerful, we're going for elections next year. We have a very powerful candidate. And guess what? He's riding on sex workers. I'm just waiting to see. I know of a couple of sex workers who are on his campaign or are also running on the same ticket as the main contender, right? So we are looking. Let's wait and see what's going to happen. Because in 2019, when we had the repeal 162 section of our penal code and we went to courts, we lost. We lost that case, and we were there in numbers, but we still lost. So, yeah, it's that catch-22 type of a situation.
Thank you very much, Tatsi. No, we truly appreciate it. Thank you very much for that wonderful presentation and for regaling us. I think there are very many strategic opportunities for us to engage, as you've mentioned, especially because the SDGs is what the world should all be uniting around, especially now with COVID-19. We will see what happens, as you say, but in all of our countries, I think there's very many weys for us to do this. Now that we've come to a very interesting part of the program, we've had actually to change a few things around, because we were supposed to, as you know, start with the sex worker panel and then move swiftly along to the rest of our speakers. We did not manage to do that because two of our speakers couldn't speak. We'll fix that, and they will present tomorrow morning as we start. They'll be the first speakers, so it's not as though we're not going to hear from sex workers themselves. We will definitely be hearing sex workers' voices over and above what Martin contributed this morning. Secondly, what we will be doing is we are now ready to move on to the part of our discussion where we break away into various panels or working groups. As you will recall, when you registered, you mentioned that you want to belong into one working group, and we've got 3 working groups that are currently operating. These working groups are ways to invest in protection and livelihoods. That is Breakaway Group 1. Breakaway Group 2 is human rights. And Breakaway Group 3 is access to health and social protection services. The reason why we're having these breakaway groups is because, as Maria mentioned, what UNFPA and ASWA did was first do research around the problem areas or the gaps that were being faced within sex worker programming in East and Southern Africa. Secondly, we're now having this consultation with you. And the reason why we're having this consultation with you alongside the UN family, as well as civil society partners, is because we want to develop a joint regional advocacy framework that addresses these three areas for East and Southern Africa. So every one of us has a role to play, but we need to define what this framework should look like, what should be included in this framework, in those three areas, and what should our advocacy look like for the next 5 years in order for us to reach the 2025 targets. So how are we going to do this? As you will recall, when you registered, you got feedback in terms of, yes, you've been registered, here's the meeting link. Under that, you received instructions as to which working group you would join. So I'd like you, when you leave this platform, to go back to your email and to look at which working group you're part of. And that working group is the one that you are now going to, you're going to click on. That's the Zoom link you're going to click on. And that is where it's going to take you to your working group where you will meet your chairs. We've got 3 or 4 chairs in each working group. Under Breakaway Group 1, we've got 2 chairs. We've got Nonhlanhla Xaba, who was from the World Food Program, who will be accompanied by Charles from ASWA. Under Working Group for Breakaway Group 2, you've got Dottie Ogutu, the wonderful Dottie, who's just presented with us. And under Breakaway Group 3, which focuses on access to health and social protection services, you've got the amazing Maria Stacy, who was the author of the report alongside with Dottie. So as I said, don't just leave this meeting because we're saying goodbye. What you're going to do for the next 5 minutes is, again, you're going to take your tea break, you're going to take your bathroom break, and then you're going to go back to your email and click on the second link and go into your working group. The working groups will commence at 12:17 my time in SAS in South Africa, and they will continue until 1 p.m. Your chairs will guide the discussions. There's a few questions that they'll ask you around what sort of advocacy messages do we need? What are the critical areas should we be focusing on? And this is what's going to be informing this framework. Remember, without your voices, we cannot have a framework that is inclusive. We'd like to hold each other accountable. We'd like to hold the UN family accountable, as well as civil society and our governments. And this is your opportunity to now speak to each of the chairs and to actually start having discussions. And you will have the liberty to actually raise your hand and contribute. So from my side, I'd like to thank you all very much for this wonderful morning. And as your facilitator or as your chair for the day, I will see you tomorrow morning, bright and early at 9 o'clock when we commence with day 2 of the program. Please do not go away, go take your tea break and come back into your working group. If you've got any issues, please do send one of us a WhatsApp. You've got our numbers, or send us an email and we'll be able to assist you. Thank you.